Folks often ask, what's the difference between Vaxd, spinal decompression, and traction? And the answer is a lot. Vaxd is unique in that it is the leader in the field of disc decompression. It invented the field, and to date, it's the only device that has ever been shown to drop the pressure of a human intervertebral disc in a live patient. It can be done with the cervical or the lumbar. It can be done prone or supine, although 30% better results occur prone. One can hold on with hand grips, use arm rests, or a strap. Cervically is done in a cervical collar with a 3D tension headpiece. Here's the big difference. All of these devices that basically have a winch and a cable, that's traction. Spinal decompression, they took that same device and made it look a little fancier, put a big casing around the winch and the cable. Some put a TV in. It's not the same thing as decompression, not by a long shot. So all the papers filed with the government on how their devices work show that these devices use a standard square wave, right? So distraction is not decompression because proprioceptors recruited by the back and trunk muscles cause guarding. The chest harness can increase interthoracic and interdiscal pressure. As you'll see in a document in another part on this website, all of the devices other than Vaxd show this square wave curve, which is completely different than this logarithmic curve that occurs with Vaxd. You know, they spent 6 years at a teaching hospital figuring out how to get around the muscle guarding. And it was the fact that it pulled slowly over time, that's number one, and number two, the fact that there's a tensiometer. So if the muscles should spasm, the computer would register that and for a brief moment stop, thus allowing the muscle spasm to relax, thus truly allowing the disc to decompress. So with that in mind, this logarithmic curve of pulling slower all over time, right? That doesn't allow the muscles to spasm. That was patented back in 1998 is when the patent was filed by Vaxd. And what in fact it showed was that Vaxd was able for the first time to avoid the muscle guarding and thereby achieve true disc decompression. This was done by two neurosurgeons, and what they did was they inserted a cannulus, right, a catheter and a cannula into the intervertebral disc. And what they wanted to do, this was in 1994 at Rio Grande Regional Hospital, McAllen, Texas, a division of neurosurgery. A fluoroscopically guided cannula was put into the disc, and they measured for the first time a significant drop to a negative value inside a human body. This discovery led to the landmark clinical study that showed for the first time that it was possible to lower intradiscal pressure with non-surgical treatments. So what they did is this patient, and you can't do these kind of studies anymore because of all the new laws and rules protecting patients, but they literally inserted a catheter and a pressure gauge, a pressure transducer, and that was then monitored while the Vaxd was decompressing. And what they saw was, unlike traction, which maybe drop the pressure from maybe a starting point, just like your blood pressure is 100, 120 over 80. A normal healthy disc has a pressure around 100, and as you bend and move, that pressure goes up and down. If the disc is severely damaged, that pressure might be as high as 500 and 600 all on its own, which is why it's so painful to move. So what happens is with traction, the pressure might drop a little bit, but after 40 pounds of pull, the brain senses danger and begins the muscle guarding reflex, which drives that pressure up. That's the exact opposite of what you'd like to do. Vaxd was able to, with its patented logarithmic curve, drop that pressure down to a negative 150. That was, again, the first time it was ever shown in a live human subject to be able to create a negative pressure inside the human body. So Vaxd does reduce the interdiscal pressure, does increase oxygen and nutrient diffusion into the disc, does allow for aerobic metabolism to help that disc to repair. Traction, on the other hand, causes the intradiscal pressure to remain unchanged or to increase. Because it causes a positive intradiscal pressure, it inhibits the diffusion with lactic acid accumulation inside the disc, which allows the disc to fatigue and cause pain. Also causes anaerobic metabolism because you can't get fluids to imbibe or cross back and forth across the disc wall, and therefore you're unable to truly draw the disc back in, retract the disc, and allow new type 4 collagen cells to form and allow that disc to heal. In fact, Dr. Ferrari said, looking at this left protruded disc, you can see it. I'm not sure why that thing is so big. It's sticking out right here. And on the post-MRI, it is gone. He says the most dramatic reduction of an extruded disc segment that he'd ever seen. When we take a look again at another MRI, we have another rather large protrusion right here compressing on the left nerve root. And after Vaxd, we can see that has retracted and the nerve root has been decompressed. Having said all of that, so traction is any flat table with a winch. And basically what was done, because traction is not recommended to treat or diagnose a disc issue, traction, to make it look sexier, was relabeled as spinal decompression. They built a tower around the winch and the cable. Some even went so far as to put a TV. The unfortunate part is it still uses the square wave. It still has never been shown to drop the intradiscal pressure. Unfortunately, all makers of traction and spinal decompression claim to cause fluid to transfer back and forth across the disc membrane. They claim to drop the intradiscal pressure, but in fact they can't because Vaxd owns the patent on that process. Sort of like if I had a Formula One car that went 200 miles an hour and you had an old Volkswagen that you put a kit onto and made it look like a Formula One but truly had a Volkswagen engine, you couldn't claim that it ran 200 miles an hour. But a lot of these companies with marketing, some are not such good people. Some of them went to jail. Some had a $400 million lawsuit filed against them by the state of Florida. Others, similar, they just dropped and changed their name and came back on the scene. So when we take a look at a Vaxd, this not only do we pull in a straight linear motion, we have a biofeedback loop, the patient is connected to the computer, but we can also change the angle, whether it's for a lumbar or for a cervical, and thus affect different joints differently. And so as we look at all of this, Vaxd is just absolutely spectacular. Same thing with the cervical spine. We're able to do it linearly as well as in flexion, or it can go down and pull an extension, whichever the extension would hit more the upper discs, the flexion would tend to hit the lower disc. Whatever is most comfortable for the patient and induces the least amount of discomfort would be the best position for that patient. So the wonderful thing about Vaxd is it does truly allow the discs to decompress. Kirkcaldy-Willis said vertebral disc decompression creates a favorable diffusion gradient across the end plate, enhancing disc nutrient transfer, promoting the natural healing process. See, discs are self-healing, except when they get stuck and they don't imbibe anymore, and the pump begins to fail, basically. Then we don't get fluids, then we begin to dry out, then we begin to crack. So what happens then is we now know that getting this rich nutrients back inside the disc is what allows it to heal. Getting glucose and oxygen back in there is what allows the disc to heal and repair. Vaxd does own the studies. There's tons of studies performed by Vaxd, many done by neurosurgeons, many published in peer-reviewed medical journals. No other company claims that. They all mostly quote Vaxd or have some independent study on their own, but a Vaxd is unique in the fact that it is the device that the entire profession of disc decompression was founded upon, because it truly is the only one that has been shown to drop that pressure. And